Hello everyone, I'm Dr. Matthew Reedy with Trillium Creek Dermatology, coming to you today with my colleague Dr. Wyatt Andrasik and our founder and medical director Dr. Helen Torok. The next topic is talking about winter weather and the dermatologic conditions we see, and this is the perfect day to discuss this. Currently we are January 2025 in Ohio, Northeast Ohio. It is below zero. Most of the schools in Medina County are closed due to the cold weather. My son is sleeping right now at home. He doesn't have to go to school. I am jealous. But yes, it's perfect time to talk about this. So Dr. Andrasik, why don't we start with you?
Sure.
With the really cold winter weather, what skin conditions are you seeing, and what tips do you have for our patients?
Yeah, so probably the most common one is eczema or atopic dermatitis. We see that when the heat comes on, we lose water through our skin, and so that heat really draws the water out of our skin, it dries it out. And when you dry out the skin barrier is not as good. And so things that we use in our everyday products, like our personal care products that include body washes, detergents, that contain fragrances and preservatives, those can get into the skin easier and cause an inflammatory reaction. Yeah. We also see cheilitis or chapped lips as a common one. Some people will also have flares of their psoriasis during the winter, and I think part of that is linked to the wintertime. Infections are going around, people are sick, and that can definitely trigger a flare of psoriasis.
Mm-hmm. Completely agree, yes. I'm seeing psoriasis, I'm seeing eczema flaring right now, and a lot of my patients, their skin is very inflamed. It's challenging to control at this point in the year. And some of our patients, especially the ones who are retired, will leave Ohio after the holidays. They'll head south to Florida, and they stay there for a few months, and they tell me, my skin clears up in Florida, it's wonderful, my eczema is gone. I come back to Ohio in March, and boom, there it is again. I'm sure you've heard this
all the time.
All the time. So it's very obvious that weather does play a factor. Dr. Torok, for patients when it's very cold, do you have any tips, things they should avoid to help their skin?
Well, the common things that we recommend, and most people know this, don't take long hot showers, right? Which really feels good in the morning, like this morning, right?
Yes.
Oh, warm up, loosen up, right? But those just dehydrate you more, you know? Everybody in January starts their New Year's resolutions, right? So what are they doing? They're going to the gyms, right? They're in the hot tubs, they're in the showers, they're just sweating, and they're drier and drier. So as soon as you take that shower or whatever, your bath, hydrate, moisturize, trap the moisture in your skin, trap that water in your skin. And the one product that really traps things into your skin is Vaseline. It's greasy, right? Mm-hmm. It's okay on the face, but to put it on your body, it's a little greasy. So use moisturizing creams, not lotions. They're loaded with glycerin, a little bit of wax in there, minerals, and a little bit of Vaseline, but not a lot. And that is a very good vehicle, is a cream vehicle. Mm-hmm. All right.
Yep.
Yeah.
Yes, all good points. Something I think is important for our patients to know, a lot of them with their eczema, their dermatitis, their psoriasis during summer months, it's not very bad. You can manage with your topical medicine, with a cream. I think it's important though for patients to know it flares in winter. A lot of times the prescription cream you have isn't enough. And today in dermatology, it's a wonderful time to be practicing. We have so many new medications to treat eczema, to treat psoriasis. They're extremely safe, they're extremely effective. And patients should know you don't have to suffer through winter anymore. So if your eczema is not under control, your psoriasis isn't under control, no, we have pills that you can take now. We have shots that we can give you that are very safe. And some of my patients, I only put them on these pills or these shots in the winter, and then they ask if they can come off of them in the summer, and I'm always open to that idea. I always say patients have a say in their care, and if you want to come off of your medicine in the summer, I'm fine with it. But just know you don't have to suffer through winter. We have so many great options now, so come see us and we can talk about them.
I think it's an important point too is if you do start developing a rash or a dermatitis, to come in early and have it treated, because we know that these can really get out of hand, and they can get out of hand quickly. There's a condition called erythroderma where it's basically your eczema or your psoriasis that's covering more than 80% of your body, and that could be a medical emergency. So early treatment's always important.
Yeah, very good point.
Yeah, great point.